There are three stages of caring for an expecting mother. We have prenatal, intranatal, postnatal care. This is essential to ensure smooth pregnancy and labor and to keep the mother healthy after giving birth. This care is a combined effort between the doctor and the expectant couple. So, the first topic is about prenatal care. So, what it means. Prenatal care is defined as the care given to a woman during her stages of pregnancy to monitor the mother and her fetus. So, during pregnancy, we have some foods that we need to avoid during pregnancy. The first one is spicy, coffee or caffeine, processed foods, alcohol, too much salt, MSG, taking medication without doctor's approval, and smoking. And say yes to good nutrition, the single most important factor in prenatal care. Proper weight, schedules doctor visits, can help to prevent serious complications like moderate exercise, enough rest, good hygiene, sensible personal care, in other activities, work, family, entertainment, and travel. For prenatal care, we have the objectives. Objectives is to ensure a normal pregnancy with delivery of a healthy baby to a healthy mother. So now we will proceed to antenatal visit. Ideally, we have 13 visits. 7 in first 7 months, 2 in 8 months. 2 in 8 months kasi kailangan pag 8 months na yung pregnancy mo, kailangan twice a month ka na magpa-check up sa doctors. And then the next one is 4 in 9 months. Bakit sinabi na 4 in 9 months? Pag 9 months na yung pregnancy mo, kailangan every week ka na magpa-check up sa doctors para ma-monitor nila yung baby and yung health mo. Kasi dun na malapit lumabas yung baby or yung due date mo na pag 9 months. And then minimum 4 visit. So what is the importance of prenatal care? The first one is to confirm pregnancy and assess the period of gestation, to prevent maternal and neonatal tetanus, and then the last one is to facilitate health education regarding diet, rest, avoidance, and of unnecessary travel and preparation for delivery. For components of prenatal care, the first one is identification of pregnant women and importance of early registration, diagnosis of pregnancy, clinical assessment, advice during A&B visit, nutrition, management of minor ailments, risk assessment and appropriate management, complication and management. Complication of late pregnancy, management of medical disorder during pregnancy, screening for congenital malformation during pregnancy, and management of anemia during pregnancy. For identification or registration, we have 12 weeks. 12 weeks early identification helps assessing the health status of the mother, obtain baseline information of the mother, screen for factors, referral for FRU, recall last menstrual period or LMP easily, do MTV if required, counsel of hygiene, diet, and rest, build up rapport with pregnant women. For within 20 weeks, we have screen and treat anemia, initiate prophylaxis against anemia, screen risk factor and medical condition, develop individualized birth plan, immunize with tetanus toxoid, investigate HB, blood group, urine examination, BDRL, or blood groupings. For 20 to 32 weeks, we have aim at the following: detect PIH, multiple gestation, anemia, develop individualized birth plan, give TT, assess IUGR, refit HB estimation. And for 36 weeks, we have PIH, detect the following: identify coital and presentation, rule out CPD in prima gravida. So now we will proceed to role of the nurse in prenatal care. The first one is registration. Registration, the nurse has to registration to the prenatal mother so that to assess the following condition, which is to assess the health status, to identify and manage high-risk cases, to estimated EDD or exact date of delivery more accurately, to give the first dose of TT after 12 weeks, to help the woman for an early safe abortion if it's required by her, to start the regular dose of folic acid during the first trimester, For prenatal service for mothers, we have to check the health history, physical examination, laboratory examination, urine stool, blood count, HB, serological blood groups, and then the next one is high risk of Roche, IFA and necessary medication, TT immunization, health education, home visit, refill are needed. And then the third one is maintenance of records, like we need to know the antenatal card, antenatal register. And then we have antenatal checkup, like for history, to diagnose pregnancy, to identify any complication during previous pregnancies, to identify any medical obstetric conditions that may complicate their pregnancy. And then for the next one is order of the pregnancy or calculation of EDD. As for the first day of the last menstrual cycle or LMP, as for the date when the potential movements were first felt or like the quickening, also assess the pudendal height to estimate the gestational age, and as for the test done to confirm the pregnancy. And then the next one is age of the woman, complication when 16 years old or to 40 years old, order of the pregnancy like prima gravida and multigravida are at risk, and then the birth interval ideally should be 3 years. So the next one is symptoms during the presence of pregnancy. Symptoms indicating discomfort of pregnancy. The first one is nausea and vomiting, which is the first common. Heartburn, constipation, frequency of urination, and symptoms indicating that a complication may be arising like fever, vaginal discharge or bleeding, palpitation, restlessness at rest, generalized swelling of the body, oliguria, decrease of absence total movements. And then for the sixth one is previous pregnancies or obstetric history. We need to check the number of earlier pregnancies, abortion or deliveries, number of premature births, stillbirths, neonatal deaths, hypertensive disorders or pregnancy history on convulsion, prolonged obstructed labor or malpresentation. And then the next one is history of any systemic illness, like we need to check hypertension, diabetes, heart disease, tuberculosis, renal disease, convulsion, asthma, rashes, or jaundice. And then for the next one is investigation. The nurse should undergo following investigation, which is the CVC, blood grouping, urine output, RBS, BDRL, HBS, or ultrasound. Early pregnancy, preferably at 10 to 13 weeks. Determine gestational age, detect multiple pregnancy, help the later screening for Down syndrome. And then the next one is ultrasound. At 11 to 14 weeks, offer nuchal translucency screening for Down syndrome with other tests if available. At 18 to 20 weeks, offer screening with ultrasound for congenital abnormalities. And then for the 36 weeks, for fetal maturity, placental previa. And then for the next one is antenatal advice. We have diet. Diet should be nutritious, balanced, light, easily digestible, rich in protein, mineral, and vitamin with woman's choice. Iron and folic acid supplement, of course. And then the next one is rest and sleep. We have night. We need to have 8 hours, and then avoid heavy work, avoid the supine position, especially in late pregnancy. If it's necessary, a small pillow under the lower back of the level of the pelvic should be used. And then the next one is abstinence. Abstinence should be avoided in first trimester and last 6 weeks. And then the next one is bowel. Regular bowel movement may be facilitated by regulation of diet, taking plenty fluid and vegetable and milk. And then for the next one is traveling. Should be avoided in first trimester, of course. Last 6th week. Air traveling is contraindicated in placenta previa. preeclampsia, and severe anemia. And for the next one is immunization, indicated TT, HAV, HBV, rabies, contraindicated live virus, vaccine, rubella, measles, mumps, and varicella. And then the next one is personal hygiene. The nurse should advise the mother regarding the personal hygiene, and it's important. And then the next one is drugs. Sedative, anticoagulant, anti-rhodism, hormones, and antibiotics should be avoided, of course, during pregnancy. And the second to the last is occupational hazard. Lead, mercury, X-ray, and elite oxidide we need to avoid. And then the last one is danger warning sign. Past, difficult breathing, decrease of or absence of vital movements, excessive vomiting, any bleeding, heavy, severe headache with blurred vision, convulsion or loss of consciousness, labor lasting longer than 12 hours. Preterm labor, preterm labor, premature or pre-labor, rupture of membrane or PROM, continuous severe abdominal pain. And then we have nursing responsibilities for intranatal care. Of course, health teaching for the mother or pregnant woman. The first one is breastfeeding. Breastfeeding for the mother is the most important thing we need to do. Dahil ang gatas ng ina ang pinakamabisa or masustansyang pagkain na maibibigay natin sa mga baby. And then the next one is nutrition. Nutrition, of course. Family planning. Family planning, kailangan natin maituro sa mga mother ang family planning. Postnatal exercise, child care, dental care, clothing, care and rest, of course, smoking and alcohol, birth plan, mental preparation, diet, sleep and rest to avoid stress or minor illness. So now we will proceed to the intranatal care. So what is intranatal care? Care of a woman in all stages of labor is known as intranatal care. So we have normal labor. Normal labor is also known as eutosia. Spontaneous is onset low risk at the start of labor and remaining so throughout labor and delivery. The infant is born spontaneously in a vertex position between 37 and 42 completed weeks of pregnancy. So we have stages of labor. We have first stage, second stage, and third stage. So what is first stage? Starts with onset of regular uterine contraction and ends with full cervical effacement and dilatation. For second stage, from full dilatation till delivery of fetus. And then the third stage is delivery of the placenta. And then we have this one, like we call trends. The first one is we have choice of place and healthcare provider. So as a pregnant woman, nasa yung choice kung ano yung magiging decision mo for the place and healthcare provider para mag-support sa pregnancy mo. And use of natural comfort aids. One-to-one midwifery care, of course. Childbirth education classes. It's very important. We have education classes to the pregnant woman. Partograph. Water birth. So now we will proceed to scientific care for intranatal care. The first one is we have breathing and relaxation. So what it means? Breathing deep and slow pace. Breathing helps in minimizing the pain. For relaxation by using music and guide imaginary will help in reduction of pain. So the next one, we have hydrotherapy and effleurage. Hydrotherapy, bathing, showering, whirlpool baths with warm water is more helpful during your delivery. Effleurage and counter pressure, light massage will help in minimizing the pain. The next one is ambulation and position. For ambulation, enhances the uterine cavity and distract the woman from the discomfort. For different position, used in first stage will speed up the labor process. The next one is birthing balls. It is a large air-filled rubber ball. We have 60 cm in diameter, made up of extra tow non-slip burst proof that is easily wiped and cleaned. The woman will be sitting over the line, leaning on a verting ball. After 2 cm of dilatation for 15 minutes can help to or can reduce the pain. The next one is partograph. Partograph is a chart in which the salient features of labor are entered in a graphic form, and it provides the opportunity for early identification of deviation from normal. And then the next one is water birthing. It is a process of giving birth in a tub of warm water. Heat as a non-pharmacological method of pain relief helps in reducing the pain intensity and increases the pain consistency. So now we have the nursing responsibilities during intranatal care. The first one is nursing duties during the birth itself include monitoring fetal heartbeat and the length and strength of contraction. Of course, the next one is administering medication. And then the last one is coaching the mother and assisting with any complication that arise during her labor or deliberation. So the last topic is about postnatal care. So what it means? Postnatal care is essential for 6 to 8 weeks after the baby is born. During this period, the mother goes through a number of physical and emotional changes and thus requires rest, nutrition, and vaginal care. So for postnatal care, we have the important condition we should inquire in postnatal care. The first one is inquiry of the mother. Any excessive pee and bleeding, febrile pyrexia, febrile sepsis, involution of the uterus, breast complication, we have breast engorgement, mastitis, cracked nipple, and breast abscess. And then the last one is inquiry of the baby. Exclusive breastfeeding, giving the baby warm, dry and warm, delayed bathing for 72 hours. Siyempre, of course, immunization, importance of neonatal care. So we have a schedule of postnatal care. First, within 24 hours. Second, within 2 to 3 days. Third, within 4 to 7 days. Fourth, within 42 to 45 days. For postpartum danger sign in the woman, swollen, red or tender breast or nipples, problem for urinating or leaking, increased pain or infection in the perineum, infection in the area of the wound, redness, swelling, pain or pus in the wound site, smelly vaginal discharge, severe depression or suicidal behavior, ideas, plan or attempt, including depression, of course. The birth of a new baby can lead to many emotional changes. Many women go through a period of mild depression following the birth of baby. There is a need to differentiate between postnatal blues, feeling down, which usually occur in the first week and can last up to 2 weeks after birth, and postnatal depression, which is much more severe and usually lasts for a longer period. You may well have a local word for mild depression or blues that women experience the following birth. Use this word when you discuss the topic with women and their families to differentiate from postnatal depression, which is different. When the mother experiences low energy, fatigue, sleep, or appetite problems, then she may have a postnatal blues. True postnatal depression is when a woman depressed considerably for more than 2 weeks, enough to disturb routine activities. So next we have danger sign for the newborn. The first one is difficulty in breathing or in drawing, fits, fever, feels cold, bleeding, not feeding, yellow palms and soles of feet, diarrhea. And we have nursing responsibilities in postnatal care. Encourage women to do things for themselves that they enjoy, such as spiritual relief through prayer, medication, meeting a friend, getting out of the home or walking, or things which help them to let their feelings out, singing, drawing, or writing. And supporting for depressed women who have depression need emotional support. Reassure them that this is usually a temporary condition that happened to some women who have given birth. It sometimes helps it women Know that feeling depressed following the birth of the baby is normal and many women experience this feeling. Try and talk to women's family and explain to them the need of extra support of this type. Nursing responsibilities include postpartum care. While most attention to pregnancy care focuses on the 9 months of pregnancy, postpartum care is important too, of course. The postpartum period lasts 6 to 8 weeks, beginning right after the baby is born. During this period, the mother goes through many physical and emotional changes while learning to care to her newborn. Postpartum care involves getting proper rest, nutrition, and vaginal care. We have getting enough rest. Rest is crucial for new mothers who need to rebuild their strength. To avoid getting too tired as a new mother, you may need to sleep when your baby sleeps. Keep your bed near your baby's crib to make night feeding easier. And allow someone else to feed the baby with the bottle while you sleep. And then the next one is eating right. Getting proper nutrition in the postpartum periods is crucial because of the changes of your body goes through during pregnancy and labor. The weight that you gain during pregnancy helps make sure you have enough nutrition for breastfeeding. However, you need to continue to eat healthy diet and delivery. Expert recommended that breastfeeding mothers eat when they feel hungry. Make a special effort to focus on eating when you are actually hungry, not just busy or tired. And then the last one is vaginal care. New mothers should make vaginal care an essential part of their postpartum care. You may experience vaginal soreness, you had tear during the delivery, urination problems like pain or frequent urge to urinate, discharge including small blood clots, contraction during the first few days after delivery. Schedule a checkup with your doctor about 6 weeks after delivery to discuss symptoms and receive proper treatment. You should abstain from sexual intercourse for 4 to 6 weeks after delivery so that your vagina has proper time to heal.